Hi, this is Dr. Bhavesh Gupta from Clinic International. Welcome again to our channel, and today we are making a video on a drug called as Finasteride. What is this Finasteride and why there is so much of buzz going around about this drug? What is the magic behind this drug and why it is so important for us to know in detail about this drug? So we will discuss in detail about this drug in this video. And secondly, we are making a series of video on Finasteride where you will understand each and every detail about Finasteride. This is basically meant for educational purpose. No treatment should be started or discontinued based on this video. It is only and only for educational purpose. Now what is this Finasteride? This Finasteride is basically a drug which prevents the conversion of testosterone to dihydrotestosterone. Now how it prevents it? When the testosterone gets converted to dihydrotestosterone, for this conversion there is an enzyme which is mandatorily required, which is called as type 2,5 alpha reductase. Finasteride inhibits this enzyme, and by inhibiting this enzyme it prevents the conversion of testosterone to dihydrotestosterone. Now what is this dihydrotestosterone? It is called as DHT in short form. What it does is it basically goes and gets attached to the DNA of the hairs. Once it gets attached to the DNA of the hairs, it causes miniaturization of the hairs. As you can see in the picture, the first picture of the hair, what you can see, DHT has got attached to it, and once it gets attached, it thins out the hair, and this thinning process is called as miniaturization. Now this process of miniaturization may eventually what it does is it makes a person bald. So when there is genetic influence of androgenetic alopecia which a person gains from his family, he doesn't get bald overnight. His hair starts to thin out. When he attains the age of puberty, at that stage the testosterone are high in amount in the blood, and this gets converted to DHT because of this 5 alpha reductase, and this DHT goes and binds to the DNA. Once it binds to the DNA, it causes irreversible damage to the DNA of that cell of that hair, and because of this irreversible damage, the hair becomes to thin out, and over the period of years, this thinning will eventually lead to baldness. Now why Finasteride is such an important drug? It is important because it is the only and only US FDA approved drug which prevents the conversion of testosterone to dihydrotestosterone, thus preventing or delaying this thinning process or this miniaturization process. Now this DHT or dihydrotestosterone, when it gets attached to the DNA, can it destroy all the hairs on the scalp? No. It gets attached to the cells of the hair which contains AR receptor. These AR receptors are the receptors present on the DNA of the hair, of the cells in the cells of the hair. DHT can get attached to those DNA only and only when there is AR receptor present on the DNA of the cell. Now does all the hairs on the scalp has this AR receptor? No. The hairs only in this area, the frontal and the crown area, they are supposedly supposed to have this AR receptor present on the DNA of their cells, and that is why DHT can only go and attack and cause miniaturization of the hairs in the frontal and the top area. But the side and the back hairs are not affected by DHT because there are no AR receptors present in the cells of these hairs. And since there are no AR receptors present, DNA cannot go and get attached itself to DHT cannot go and get attached to the DNA, and since it cannot go and attach, it cannot create a irreversible damage in the cells of those hairs. That is why when you see a patient getting bald or a person getting bald, he gets bald preferably only in the area which is front and top of the head, and in 99.9% of cases he never gets bald in the side and the back area of the head. Now Finasteride is the only US FDA approved drug to delay or to stop this androgenetic alopecia process. Now what happens is we have to understand in which cases this drug is indicated and in which cases these drugs are not indicated. So the first and the most common indication is in patients suffering from androgenetic alopecia or miniaturization of hairs between 18 to 55 years of age. Second, once the patient crosses the 55 years of age, the dosage can be manipulated accordingly. When it is contraindicated, and basically it is indicated for men, not for women. When it is contraindicated, specifically it is contraindicated in women in childbearing age or for a woman who is pregnant. Now the first and the most commonest indication what we give when we give Finasteride to our patients is when the patient is young, he has a genetic history of baldness, and the patient has just reached age of 20 or 22, and then what we notice is he has started to develop this thinning of hair, and that is the first indication, the most strongest indication to start Finasteride. most of the balding or this thinning of the hair can be reversed when the finasteride is started on the right time. So it is very important for you to understand that if the treatment is started on the right time, lot of thinning of hairs or balding can be prevented or can be delayed by a good decade or two if the finasteride is started on the right time. The second indication what we see when patient comes for hair transplant, they've come to our clinic to undergo hair transplant, but they still complain that they have some amount of hair fall. In this condition, hair transplant cannot be done when there is active hair fall, and we give finasteride and oral supplements and topical minoxidil to the patients. And first we control the hair fall, and then we do a transplant. And after transplant, the same finasteride therapy has to be continued after for the first 6 months after hair transplant. A lot has been known and has been mentioned in the literature about the side effects of finasteride. How common are the side effects? These side effects are really rare. You can say approximately out of 100 patients, maybe 1% of patients can get some amount of side effects from finasteride. What are those side effects? The first and the most common side effect what we have noticed in our clinical practice is weight gain. Second is gynecomastia. Third is loss of sexual desire or loss of libido. The fourth is erectile dysfunction, and the fifth is the decrease in sperm count of the patient. Now, how common are these? It is really very uncommon to see. Theory or literature mentions that it can be seen in approximately 1% of patients. The good news is finasteride is only works in the body till you take it. It maintains the tissue level till you take it. The moment you stop it, it again goes out of the body through the urine. And we have to understand that if you are in that 1% of unlucky patients who has got side effects because of finasteride, the moment you stop it, half of the drug is washed out of the body in the 1 week after stoppage of drug, and the remaining of the drug, mostly it is washed out in within next 4 to 6 weeks. So theory and literature has proved that finasteride, if taken for the first 6 months after transplant, definitely makes a lot of difference in the kind of hair growth which is noticed after transplant when you take finasteride and when you miss or when you skip finasteride. Now, even in men between 18 to 55 years of age, finasteride is effective most commonly in the anterior hairline region as well as in the crown region and mid-scalp region. It is never meant to prevent or to reverse the bitemporal recession. So it cannot prevent or it cannot reverse the balding caused by temporal recession. It is only meant for the frontal and the top area of the head. Now, what is the dosage of finasteride? In the FDA-approved dose is tablet finasteride 1 mg per day. This finasteride comes in market in the form of in the dosage of 1 mg supplied by different companies. This is basically for androgenetic. This dosage is basically for androgenetic alopecia. When this finasteride also has an indication to prevent or to delay in the treatment of prostatic hypertrophy, and the dosage in those cases 5 mg per day. So the dosage what we are concerned about is 1 mg per day for our patients. So now, can we give this finasteride to every patient who is suffering from androgenetic alopecia? First, we will have to evaluate that if patient has any other medical condition or medical comorbidity, like the patient is obese, or he has any liver dysfunction, or he has any erectile disorders, and he has any kind of psychological issues. We have to evaluate this before starting finasteride therapy in any case. Now, what is the right time to take tablet finasteride? Normally, literature has shown that the androgen surge in the body is in the morning time between 7 a.m. to 9 a.m. and if the finasteride reaches its peak level during that time, it works the best. And for us to make sure that the serum finasteride level reaches that peak level in the morning hours, we advise our patient to take tablet finasteride 1 mg per day before sleeping at night. Finasteride basically doesn't interfere with food, and that is why it can be taken even empty stomach, or it can be taken after the meals. First thing. Second thing, it is very important for a patient to understand that finasteride will not work alone. Along with that, hair supplements and topical minoxidil or amino acids will be prescribed to you by your physician or by your doctor, and it will start to show results in next 2 to 3 months. So we basically call the patients after 3 months of therapy, and then we evaluate the efficacy of this drug on the patient, and accordingly we titrate the dose. 1 mg need not be continued for lifelong. The duration of the medicine which it needs to be continued from, it does not remain same for all the patients. It varies from patients to patients, and it varies from condition to condition. If patient has taken therapy for first 6 months and we have noticed a very good hair growth and there is no side effect, we can might as well advise the patient to continue this for some time more. If we see some kind of side effects coming up, then we start to customize the dose for the patient. And customizing this finasteride, we normally advise our patients to take from Monday to Saturday 0.5 mg. Now this 0.5 mg dose is not available in the market, and we ask the patient to split the pill with the help of a pill splitter. Again, the maximum age group of patients whom we see for hair transplant or whom we see for hair loss, the range is between 20 to 35 years of age, and we have to understand that their anxiousness about the drug, and we explain them the real benefits of this drug and the safety profile of this drug. Again, in patients who are married and who are planning a family, during that period we advise our patients that you have got a transplant done or you are taking finasteride for preventing or avoiding hair loss, then you better stop at least 2 to 3 months before doing a family planning, and then again the drug can be continued once your wife gets pregnant. And when we advise our patients to take a long-term finasteride, the patients who have a history of thinning of hairs, and we advise them to take finasteride for next few years. So basically what happens is when the patient takes finasteride for 3 to 4 months continuously, some amount of tissue buildup happens of finasteride in the body, and we ask a patient to take a break of at least 2 or 3 weeks in between, and then again continue the finasteride. Again, one more phenomenon what we have noticed is, if a patient is taking finasteride for 6 months to 1 year continuously, sometimes body gets resistant, and the effect of finasteride what patient was experiencing or gaining at the starting of the treatment, now it has decreased over a period of time. In such cases, we ask the patient to take a break of 2 to 3 weeks, or in some cases where the hair fall has still not been controlled completely, we ask the patient to add 1 dose of daprodustat once in a week to just you can say boost the effect of finasteride in such cases. And now we will discuss about the side effects. As we discussed about the sexual side effects which is making a buzz on the internet, and there are so many big companies or marketing companies claiming that they have DHT blockers better than finasteride, we don't have to rely on finasteride. But the real truth is finasteride is the only and only medicine which will control DHT and which will make sure the DHT doesn't cause a miniaturization of the hair. So most of these companies, they are into this marketing gimmick to promote or to sell these high-end products, just you can say just fear mongering the patients and making sure that they don't reach the right drug, because finasteride is not costly, it's a very cheap drug, and that is why a lot of big companies and marketing agencies, they are not promoting it so much, and they are just earning on the fear of the patients. In my 14 years of experience, we have given finasteride to not 1 or 2 but to thousands of patients to combat this hair loss or to promote the hair growth after hair transplant, and we have seen some side effects. We have seen some patients coming back to us with a complaint that they have some sexual dysfunction, and we have stopped finasteride in such cases, and we have noticed that in most of the cases the side effects what patients have got has actually got reversed over a period of time, and we have given them the alternative drugs which can be given. Those even though those drugs are not as effective as finasteride, but in cases who actually has a sexual side effect, then we can think or opt for other treatments. But in clinical world or in private practice, the incidences of such cases are really low. So remaining patients who are actually anxious about starting this drug, you can always start this drug, because in case it is not working for you or in case it is giving you side effect, it can be stopped anytime, and once you stop it, the tissue levels of the finasteride are completely eliminated in next 6 to 8 weeks of your stoppage of this drug. And even if you are in that 1% of patient who has actually got sexual side effect because of finasteride, you can try Indian herbs which increases semen count, sperm count, and which are known to make your sexual life better. The herbs like ashwagandha, satavari, gokshura, safed mulchi and shilajit, these are the herbs which are completely free of any kind of side effects, and you can always consult your Ayurvedic specialist or Ayurvedic doctor, and you can take these herbs along with finasteride, so you have positive effects of finasteride as well as you avoid any kind of negative effects from finasteride. So in short, to conclude this, first point, finasteride is an absolutely safe drug. The safety profile is really good. It doesn't interfere with any other drug. If you are a diabetic or if you have hypertension, you can continue your normal medicines along with taking finasteride. It doesn't interfere with meal. You can take it empty stomach or you can take it after meal. Fourth, the incidences of side effects are really low. And if you are in that 1% of patients who are actually seeing side effects, there are ways to combat it. Fifth one, finasteride, if taken for 6 months, for first 6 months post-transplant, definitely makes a prominent difference in your results in hair growth post-transplant. Sixth, if you are planning for a transplant but if you are in your early 20s and you have active hair fall, first the active hair fall needs to be stopped before planning for a transplant, and to stop this active hair fall you will definitely require hair supplements as well as tablet finasteride. Seventh, if patient has undergone transplant and has completed first 6 months of finasteride, then post 6 months whether the finasteride has to be continued or not continued the decision will be taken by the hair transplant surgeon who has done the transplant for you, and he can definitely make some customized dosing for you to continue the same drug for long term or in long run. We will again discuss a lot about different aspects of finasteride. We will again solve some more query which we have got from our patients in the next videos to come. Once again, Dr. Bhavesh Gupta signing off from Clinic International. See you in the next video. Bye bye.